The America's Democrats podcast, a project of 21st Century Democrats, is made possible by contributions from our listeners. Want to do more? Go to americasdemocrats.org and click Donate. And thank you for allowing us to be your voice. And if you enjoy the show, please share it with your friends on Facebook and Twitter, and leave us a review on your favorite podcast app. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. I'm your host, Jim Cuddy. This week, why 74 medical and health groups are calling climate change the greatest public health challenge of the 21st century, how cutting the Pentagon budget will make the country stronger, and Bill Press goes deep on religious freedom with Rachel Laser, CEO of Americans United for Separation of Church and State. Had enough of Fox News, the House Freedom Caucus, and Donald Trump? If you want the facts that you won't get from them or from the fake news sites of the alt-right, then stay tuned. Our sponsor, 21st Century Democrats, works hard to get everyday Democrats involved in returning our party to its roots and to success at the ballot box. Sit back and listen, then stand up and fight. And follow 21st Century Democrats on Facebook for all the latest progressive news. We're glad you can join us. President Trump and the Republican-led Senate pushing a bill that would increase military spending to over $750 billion. Lindsay Koshgarian says the Pentagon's budget is already near a historic high, and cutting it down is the best path to real American security. And we say hello to Lindsay Koshgarian, Program Director of the National Priorities Project, where she oversees nationalpriorities.org. Lindsay Koshgarian, thank you so much for joining us today on the America's Democrats podcast.
Thanks for having me.
You're quite welcome. Our pleasure to have you with us. Let's talk about some priorities. One in particular. How big is the U.S. military budget?
Well, that's what I focus on. And right now, in fact, Congress is debating and going through their long process for setting next year's military budget. So this is a very relevant question right now. The 2019 military budget, which is our current military budget, is $716 billion a year. And just to put that in some context, that is more than we spent on our military at the peak of the Vietnam War. It's more than we spent in any year under President Ronald Reagan. So this is a historically high level of military spending. And to give you a picture of where some of that goes, more than half of it goes to corporate contractors.
You recently worked on a project called the Poor People's Moral Budget. Tell us about the project and your participation.
Well, the Poor People's Campaign Moral Budget is a project that we undertook as part of the Institute for Policy Studies together with the Poor People's Campaign. And for people who aren't familiar with the Poor People's Campaign, it is a re-envisioning of the 1968 campaign that was launched by Martin Luther King Jr. Just before he was killed. And it's being led by Reverend William Barber and Reverend Liz Theo Harris, so it's a faith-based movement, but interfaith. And it is meant to address the three evils that Martin Luther King Jr. identified, which are poverty, racism, and militarism, plus one that's much more recognizable for our age, which is environmental degradation, things like climate change. And the point of the campaign is that we can't solve one of those things without addressing all of them. So the moral budget was our look at what policies we could put in place and how we could change the priorities in our federal budget and state budgets to help to address those evils, to end poverty and end related injustices. And a couple of our big findings, one of the things we were really interested in is this claim that we hear all the time about, big, bold plans to help solve our problems, that we can't afford it. Money is too tight, the deficit is too high, all of that sort of thing. And so what we did was we really took a hard look at it. We took a hard look at what these things would cost and how we could pay for them. And we found over $1 trillion that we could use from fair taxes on the wealthy corporations and Wall Street, and from $350 billion a year in Pentagon cuts. And those are things that we could put toward priorities like Medicare for all or a Green New Deal or any of these other big ideas that are meant to solve the biggest problems that are facing us today.
Now, within the Poor People's Campaign moral budget, you call for a number of cuts to military spending. And obviously, we don't have time to go over all of them, but tell us about some of the biggest.
Well, the biggest one, the single biggest cut that we make is closing overseas military bases. And most people probably don't know this, but the United States has more than 800 bases around the world, not on our own land, but in other countries. We have bases in Germany and South Korea and Japan. We have a base in Djibouti, which most people probably can't even find on a map. So we have all of these bases. The next country that has the most overseas bases has only 20. So we have more than 90% of the overseas bases in the world. And a lot of those are relics of our 20th century wars. Our biggest overseas troop concentrations are in places like Germany and South Korea and Japan, where we fought wars in the 20th century and we've never left. And we see the same thing happening now with our troops in Afghanistan. So our biggest recommendation that would save about $90 billion is to close 60% of our overseas bases and to both bring those troops home, but also to transition them into civilian employment and civilian life. So that's our biggest one. The second biggest one, which would save about $66 billion, is to end our wars in Afghanistan and Iraq and Syria and Yemen and everywhere else that we have troops on the ground in about 15 countries right now. So we would end all of those, bring our troops home, continue to work in those places through diplomatic means and humanitarian means, but it's time to bring our troops home. So those are the two biggest things that we would do to save money from the Pentagon budget. And then there are others that relate to cutting unnecessary weapons systems, reducing the Pentagon reliance on corporate contractors, and many other things along those lines.
You know, I knew we had a lot of bases, and I knew there was a great gap between the next country's military presence around the world. I had no idea it was that big. That's rather sobering. We're speaking with Lindsay Koshgarian, Program Director of the National Priorities Project, where she oversees nationalpriorities.org. Lindsay, what are the consequences for Americans if we fail to cut back on military spending?
Well, we're choosing to put our resources into one place, and when we're putting them into the Pentagon, we're not putting them into other things. People are quite familiar, I think, with the fact that most other developed nations have some system of universal state-sponsored health care. We don't have one. We are not addressing the threat of climate change. And this is, to be honest, we could cut our military spending and we would be safer because we wouldn't be stoking resentment and arms races in places like the Middle East and with rivals like Russia and China. We could actually be safer if we cut this spending, and we could put that money toward the threats that are very real that we're ignoring, things like climate change and economic inequality, that are really serious long-term threats to our way of life and possibly even to our existence. But instead, we're taking all of those billions and billions of dollars and pouring them into military contractors and these overseas bases.
The military-industrial complex, though, is a hard reality in American politics. How do we muster the political will to confront it?
Well, we need a movement. We need to force our politicians to confront it. And we've actually heard that directly from some members of Congress, that they're willing to try to help, but they need us to back them up. They need us to make some noise. So that's a lot of what the Poor People's Campaign is doing on this and other issues. There's also a new effort right now, a coalition group that includes big progressive organizations like Move On and Indivisible and others, Greenpeace, that have come together to demand cuts to the Pentagon budget because all of us recognize what it's doing to our country, what it's doing to our other priorities, and that coalition is both putting pressure on Congress and calling on presidential candidates from both parties to support a lower Pentagon budget. And that's the kind of movement that we need, and we need massive support for those things. Because once we have that, the military-industrial complex and the contractors won't be nearly as strong. They have the money, and another thing they have is the jobs. They intentionally spread jobs through congressional districts so that they can continue to appeal to those members of Congress. So one thing we need is a mass movement, and the other thing we need is to create jobs in other ways. We need to create good jobs in healthcare and education and clean energy so that those communities aren't so reliant on those Pentagon contractor jobs anymore.
Mm-hmm. Yeah, and technology when it comes to climate change, things like that, there's plenty of places where we could restart everything and get away from fossil fuels and have plenty of jobs to make that all happen with wind and solar and water. I mean, it's nuts that we're not jumping all over this. And anyway, now back to where I was so I can get off my soapbox and give the soapbox back to you. There are some members of Congress that want to restore their power to approve the use of military force. How important is this to the effort to rein in military spending?
This is very important. It's hard to overstate how important it is, both to rein in the military spending that we have now and to put the brakes on potential future conflicts. Right now, there's a battle going on in Congress over whether they will be able to pass legislation that says that President Trump can't go to Iran without congressional approval. And presidents are not supposed to be able to go to war without congressional approval. A lot of people know that Congress is supposed to have the power to declare war, not the president. But for too long, we've been operating under this endless authority that Congress granted back in 2001 and 2003 to go to Iraq and Afghanistan, and presidents have used it to go to war in any number of places. Like I mentioned earlier, we have troops on the ground in 15 countries. So it's time for Congress to pull that power back, to make it harder for presidents to make unilateral, snap decisions to take us into war. And we know that right now, we've been on the brink of military intervention in Iran, which could easily lead to all-out war, even if that's not our intention. The situation could easily get out of control. So Congress really needs to take this power back. It's not just a question of stopping the $66 billion a year that we're spending on our wars right now. It's also a question of stopping the next war.
Mm-hmm. Yeah, I mean, we definitely need to take the power out of the hands of the president, especially when it comes to that. Lindsay Koshgarian, Program Director of the National Priorities Project, where she oversees nationalpriorities.org, joining us today on the America's Democrats podcast. Lindsay, we do appreciate your time with us today and look forward to having you back again with us soon.
Thanks for having me.
You're quite welcome. It was our pleasure. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen to this americasdemocrats.org podcast, a project of 21st Century Democrats. But we need you to stand up and fight. Do you want to get involved and help get our party back to its roots and to success at the ballot box? You can make your contribution to help us keep this show going and to elect Democrats who will stand up for democratic principles. Go to americasdemocrats.org and click on Donate at the top of the page.
This Social Security measure, I believe that we must pass legislation to provide medical care.
This is our tradition. When our grandparents came to America, it was the Democratic Party which said, welcome. It was the Democratic Party, the party of Roosevelt and Truman and Kennedy and others, who said that America belonged to all its people, not just a handful of the rich or a few giant corporations. That's why great leaders like FDR fought so hard for Social Security, and why JFK stood up to the insurance companies and their Republican allies to get Medicare. It's not just one thing, or one time, in one place. It's about a whole history of standing up to the Republicans and saying someone has to be on the side of regular working people in America. Whether it's defending Social Security or just the way your loved ones are treated on the job. That's what the Democratic Party is all about. And that's why this message has been brought to you by the Democratic Party. Working people like you and me.
Paid for by 21st Century Democrats. Not authorized by any candidate or candidates committee. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. Coming up next, how climate change is making us sick and how medical groups are fighting back. But first, we turn to Jim Hightower, America's #1 populist, for his common sense commentary.
While Donald Trump fans the embers of xenophobia in our country by demonizing caravans of desperate Latinos headed north from Central America, there are other northern-bound caravans he doesn't mention. These are U.S. citizens crossing our northern border into Canada, seeking relief from the profiteering cartels that run our country's predatory healthcare system. Specifically, these people are among the millions of Americans who've literally been sickened by the price gouging of pharmaceutical giants. For example, the Washington Post reports that from 2012 to 2016, drug makers have nearly doubled the U.S. price of life-saving insulin. It's a massive highway robbery that Trump and company ignore, even though it creates a financial strain so severe that many patients try cheating death by skipping some dosages, an always dangerous gamble. Outraged and desperate, many diabetics and their families are taking matters into their own hands by making cross-border drug runs into towns just north of the U.S.-Canadian line. They're drawn there by Canada's single-payer healthcare system, which protects consumers from price gouging. As the Post reported, one small group of Minnesotans recently caravaned from their home into an Ontario border town where they could buy a supply of insulin for about $1,200 versus the $12,000 they would have been charged in the U.S. Good for them, but why should anyone in our incomparably rich nation have to make border raids to get essential health care? As the organizer of this Minnesota caravan put it, when you have a bad healthcare system, it makes good people feel like outlaws. It's demeaning, it's demoralizing, it's unjust. This is Jim Hightower saying, we the people must rise up, organize, and mobilize to make healthcare profiteering unacceptable, illegal, and un-American.
If you'd like more of Jim Hightower's real populism, check out the Hightower Lowdown. Jim's monthly newsletter gives you the real lowdown on which corporations, by name, are doing what to the middle class, our environment, and our democracy. Each month, the Hightower Lowdown brings you facts you didn't know, along with actions you can take to fight back. It also comes with a sense of humor. Hightower believes we can fight the gods and still have fun. Plus, get this, it's cheap. Only $15 brings you 12 issues a year. For real populism, go to hightowerlowdown.org.
This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. Dozens of the United States' most prominent health organizations have come together to sound the alarm over climate change as one of the greatest threats to public health our nation has ever faced. Barbara Gottlieb says the time is running out to take action. And we say hello to Barbara Gottlieb, Program Director of the Environment and Health Program at Physicians for Social Responsibility. Barbara, thank you so much for joining us today on the America's Democrats podcast.
Well, thank you for having me. I'm delighted to be with you.
Well, and our pleasure to have you with us. Your organization and 73 other medical and health groups just released a policy agenda that declares climate change as the greatest public health challenge of the 21st century. Why did you feel the need to do this?
Well, the first need is that we face a really extreme threat. Look around us. Our world is warming. The seas are rising. We have affected the whole climate with what we have done with our energy use. And there are a host of effects from that affect human health. So, summer is upon us. Heat waves are coming. Heat waves can lead to lethal, that is fatal, heat stroke. There are wildfires burning. People are dying as a result directly, and then also, they greatly increase the very dangerous air pollution that can affect people hundreds of miles away. Extreme storms, cities and farms flooded, water contamination. I mean, we're seeing these things happening already, and we're kind of at the beginning of this climate change threat. We're told it's only going to get worse. World scientists tell us we have about 11 years to make changes that they say have to be sweeping, have to be unprecedented. So the time is short. But there are positive steps we can take, and that's what our call to action focuses on, that changes are possible all across our society if we move fast and hard.
Now, by drawing attention to climate change as a public health issue, How do you hope it changes the overall strategy in fighting climate change?
Well, first of all, everybody cares about health. You care about your own personal health. You care about the health of your family. And, you're also affected by the health of the community around you. So talking about health is a way of talking about climate change that catches everybody's attention, and I think it also brings us together. This is not a partisan issue, and the voice of doctors, of nurses, of public health professionals, these are not partisan voices. So we can speak through the health lens, as we like to say, and really focus on the need for everybody to get engaged in terms of some kind of concrete action to address this crisis.
As we're talking here, and I'm thinking there's so many systemic effects of climate change that people don't necessarily think about. And when we were first talking about doing this interview, I thought healthcare, and how could climate change have an impact on the jobs of healthcare professionals?
Well, of course, climate change is going to have an impact on everybody, and we're already seeing some notable spikes in health effects, so that certain health professionals, the ones that deal with certain specialties, I think are already seeing the difference in their patients. So if you're an allergist, you're seeing a lot more people coming to you complaining that, hey, the allergy season began early this year. Yes, it did. Hey, my allergies seem to be worse than they've been in the past. This is true. This is also the case for health professionals who deal with respiratory ailments, because so many of the effects of climate change, especially the heating, will affect your respiratory system. So health professionals in those specialties, I think, they've already had an impact on their jobs. But as climate change worsens, it's going to affect certain populations more and more. I mean, the effects will hit children hard, the effects will hit the elderly hard, and people with pre-existing conditions. So we can expect in the future that climate change will actually be contributing indirectly to things like heat stroke, as I mentioned, but also cardiac conditions. So think about, those sectors of the population. That's a lot of people.
Yeah.
But actually, I would say that's not really the only question we need to focus on about health professionals and for health professionals, because I think the bigger question is, how can health professionals really have an impact on the world's response to climate change? Because what we do know is that doctors, nurses, pharmacists, these are really effective messengers on questions of public health. So we're really looking to health professionals to wake us up and get us mobilized.
We're speaking with Barbara Gottlieb, Program Director of the Environment and Health Program at Physicians for Social Responsibility, today on the America's Democrats podcast. Barbara, what kinds of policies and government actions can make it easier for healthcare professionals to do their job in the face of climate change?
Well, first of all, I think we really do have to think about protecting our medical infrastructure. I mean, if we look back at some of the catastrophes that happened in Hurricane Katrina or Superstorm Sandy, and just to choose, examples from our own country, we saw people totally unable to access healthcare, hospitals that were flooded, hospitals that were closed, totally unable to operate. So that kind of basic infrastructure of our healthcare system needs to be prepared to understand what might be coming and how they can address it, whether it's increasing their own in-house energy backup systems or making themselves less vulnerable to flooding, what have you. Similarly, healthcare institutions can green their operations, so there are a lot of things that hospitals and other big medical facilities are doing already to reduce their energy use, to be more energy efficient, to use less toxic substances, and so on. These are things that the health institutions and the health sector themselves can do. But again, this is not just about health professionals. Here at Physicians for Social Responsibility, we look at climate change as a problem that we cannot cure. My organization is all about physicians and other health professionals, but curing it's just not going to be possible. This is a problem we have to prevent, and that's why policy action now is really critical. So all of us have to be looking at the need for policy action, and the place to start, of course, is reducing our use of fossil fuels. Fossil fuels are the driving cause of climate change. We burn coal, we burn natural gas, we burn oil. That's going to have to stop. And we're actually very lucky to be at a time in world history where we have really, truly clean, truly renewable options available to us, not just as individuals, but as a society. So healthcare professionals and government and everybody else is going to have to get on board and really support this transition to solar energy, wind energy, geothermal. And the really great thing is those transformations are really helpful. They improve health at the same time that they address climate change.
Mm-hmm. And the technology is there. There's no reason for us to be dragging our feet on this one. Something else I found interesting in this declaration, equity is an important part of the declaration. Why did you include that issue?
Well, I've been saying that climate change affects everybody. It actually affects some people more than it affects others. So consider the situation of poor people, people of color, tribal communities. Those populations in particular in our country, they suffer a really disproportionate burden. I guess to put it in kind of health speak, we could say they have pre-existing conditions that reflect social injustice. So what I mean by that is they tend to live in areas that are already overburdened with sources of pollution, things like coal-fired power plants that are putting out the carbon pollution, are driving the climate change, but they're also putting out really dangerous, toxic substances at the same time. This is environmental racism, and it's endemic. It affects our whole country. Also, these particular communities that suffer disproportionate burdens, as a rule, also have fewer resources of the positive kind that they need to protect their health. So they may not have health insurance policies. They may not have easy access in their communities to healthcare providers and healthcare facilities, and they may simply not have the income to be able to pay for the prescription drugs or the doctor's visits or what have you. So there's a very profound social justice issue embedded in the response to climate change. And that's actually, only a part of it. We also, as I've mentioned, the elderly, the very young are heavily affected by climate change. Their bodies are more heavily or more immediately affected. People with pre-existing chronic diseases. So again, this is a really big justice issue, and that's why our U.S. call to action really felt that it was important to make it not just about climate and health, but about climate, health, and equity. And there's also one other thing. A lot of these affected communities, a lot of the minority communities that disproportionately affected, they've been fighting this fight for a long time. They've noticed that their health is getting slammed by these sources of pollution, and so they're already leading the fight for environmental justice. And we need to join with them, work with them, take leadership from them, and we all have to unite if we're going to address this most serious health challenge of our century.
Well, and you mentioned in the declaration also that calling for building resilient communities in the face of climate change. But what kinds of changes will that entail?
Well, see, the wonderful thing is that there are so many things that we can do, and in fact, many communities are already doing it. What we need to do is to do more, accelerate those things, and also get some action out of the federal government to get action on a large scale. So let me give you just a few examples. As I mentioned, the carbon-based fuels, the fossil fuels that we burn and that we rely on for so many things, it's time for them to go. So clearly building out renewable energy and energy efficiency as well, those are the real fundamental building blocks. But resilient communities can do so much more. So one of the things we call for in our declaration, just to give you an example, is what we call active transportation. If you can get there by walking, walk. If you can get there by biking, bike. If you can take public transportation, which gets so many polluting cars off the road, that's the way to do it. So communities need to increase those kinds of active transportation options, make them available, make sure they're safe, and of course this calls for reasonable planning. other things that communities can do is to look at our food system. A lot of our food is heavily processed. It's refrigerated or frozen and trucked across the country or flown in from afar. All of those things have impact on our energy use, and so, again, are helping to drive climate change. You don't want to feel like just because you're eating a hamburger, you're driving climate change. But if we can increase local production of food, if we can encourage a plant-based diet, if we can encourage agricultural practices that keep more carbon in the soil, we're actually helping. And, if you look at the examples that I'm giving you, they're also good for your health. So we really see them as a win-win. Now, let me just add one more thing. I think we really need to look at two more aspects. One is the process. These things don't happen by themselves. So we need more education. We need more awareness building, and we need commitment. We need to involve our local communities in understanding the problems and figuring out what they can do. And there are so many things that communities can do that address the immediate impact of climate change that they're probably already feeling. So, summer or heat. If you live in a city, you probably live in a heat island. That's an area that absorbs the heat and holds the heat. And in our center cities and in the hottest parts of the year, times of the year, what happens is the buildings and the pavement absorb the heat to such an extent that the cities don't get a chance to cool off in the evenings, and then the heat builds and builds and builds. So we need to be sure that there are things like cooling centers, but we can also be encouraging, for example, on construction, what they call green roofs, where on large buildings they install gardens to cool the building and also hopefully produce food. There are green areas that need to be protected. Rainwater capture. In other parts of the country, that's not the issue. Maybe it's our vulnerability to wildfires, and that's what needs to be addressed, and that's what the community needs to plan for. Or maybe they need to be talking about how do we adapt our housing to make it more climate resilient.
Well,
so there are lots of things. Yeah?
Oh, go ahead.
I was just going to say, one of the things we need to remember, too, is that this is not a one-size-fits-all situation. The impacts of climate change vary regionally, and the needs vary locally. So we have to be very place-specific as we look at solutions, but we also have to be ready to embrace the positive solutions that are at hand, like clean energy. And we have to be willing to spend some money and make the investments, because this is what's needed for our kids and our grandkids. It's for their health and their survival.
Absolutely. And the work you all are doing is phenomenal. Barbara Gottlieb, Program Director of the Environment and Health Program at Physicians for Social Responsibility, joining us today on the America's Democrats podcast. Barbara, thank you so much for your time, and we do look forward to having you back again with us soon.
Well, thank you very much. It's been a pleasure.
Well, thank you. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen, but we need you to stand up and fight. Help get our party back to its roots and to success at the ballot box. Make your contribution to keep the americasdemocrats.org podcast, a project of 21st Century Democrats, on the air, and help elect stand-up Democrats. Go to americasdemocrats.org and click on Donate at the top of the page. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. And now Bill Press talks with Rachel Laser, CEO of Americans United for Separation of Church and State, about white evangelical support for Donald Trump and why Democrats need to talk more about religion.
Speaking with Rachel Laser, who's the president and CEO of Americans United for Separation of Church and State. Rachel, I'd like to ask you about something people ask me about all the time. You called them on the cover of your most recent magazine, most recent edition of your magazine, of AU, the Magnificent Seven. These are the evangelical leaders in this country who, come hell or high water, support Donald Trump. And they're led, of course, by Jerry Falwell Jr., James Dobson, Tony Perkins, Ralph Reed, who the other three are. I mean, the question really is, as Christian leaders, how can they support a self-professed adulterer and serial sexual predator like Donald Trump?
Because, well, I can't really answer that, but I can tell you why I think they do, which is because they think that they're getting what they want in Supreme Court justices and in intervening with women's reproductive freedom and turning back the clock on LGBTQ equality through things like the denial of care rule that was just issued by this administration that gives any healthcare provider, any insurance company, and anyone working within the healthcare system, from the orderly to a scheduler to a janitor, the right to refuse services, even emergency care, to people based on their religious or moral beliefs. Things like that policy stand in the way. They particularly hurt religious minorities, the non-religious, LGBTQ people, and women. And this community of the seven that you refer to, and frankly, this narrow sort of white evangelical community in America is grasping onto white Christian power right now in America. Really, it's a scary time. There is a time of change afoot, and I just want to acknowledge that. It's scary to live through change. So starting in 2014, this country ceased to be majority white and Christian. That's already over. Starting in 2014. That's a big deal, right? Given that white Christians built the edifices of this country. Period. The end. They did. It doesn't mean we're a Judeo-Christian nation, but that's who was here and that's who was the majority.
Right.
Starting in 2046, we're going to be majority black and brown in this country.
So you think part of their effort is really to maintain that superiority or the power of the white Christian
privilege? I do.
Privilege.
I do. And I think that it's a scary time for that. We had our first black president. We've sent over 100 women to Congress. Things are changing in this country. And a lot of people are struggling, financially. The class divides in this country are becoming greater. A lot of people are hurting, in this country. And I think that there's a grasping for privilege and power.
But it does raise the question. Look, I'm a Christian, was raised a Christian, with knowing solid Christian values that I learned from my family, and everything that I believe that Christianity stands for. Donald Trump is the exact opposite of all of it, and yet you have the leading Christian ministers, if you will, in this country supporting him. I mean, Jerry Falwell Jr. said the other day that all Christians should support Donald Trump. Quote, he even said, it may be immoral for them not to support Donald Trump because he's got African-American employment to record highs, Hispanic employment to record highs. They need to look at what he's done for the poor. He's telling us it's immoral not to be a Trumper.
How does that make you feel as a Christian?
Yeah, it makes me feel, what's it all about, right?
And a lot of people
makes me feel like he's a phony Christian.
And a lot of Christians feel like that. Conservative and liberal Christians feel like that. I've heard that from a lot of Christians in this country. But in the end, he said, President Trump said at a state dinner that he held last summer at the White House for the evangelical community, quote, the support you've given me has been incredible, but I really don't feel guilty because I have given you a lot back, just about everything I promised. And as one of our great pastors just said, actually, you've given us much more, sir, than you've promised. And I think that's true in many respects. And in fact, Johnny Moore, who's on his Evangelical Advisory Council, and by the way, President Obama had a faith advisory council with people of many different faiths and even people of no faith. But President Trump only has an Evangelical Advisory Council. We've asked under federal transparency laws to learn more about it, haven't heard boo. We've asked under FOIA, Freedom of Information Act requests to understand what they're doing. They're not being transparent. But Johnny Moore bragged in an op-ed that he wrote for the Religion News Service in 2017, quote, You only make a difference if you have a seat at the table. There is a long list of progress we've made with this administration because we took our seat at that table. We've provided consequential feedback on policy and personnel decisions, particularly affecting religious liberty, judges, the right to life, and foreign policy. We are also actively at work on issues like criminal justice reform. And when we've disagreed, we've had every opportunity to express our point of view. This is unprecedented access by one religious community to the White House.
Right. But what Donald Trump said is, I think, correct. I recently had dinner with a Republican strategist friend of mine who is no Trumper, but she told me in the end she voted for Donald Trump, held her nose, voted for Donald Trump because he promised to put conservatives, religious conservatives, on the Supreme Court, and she said,
and he's delivered. Right. And again,
and that's what it's all about for them. You're saying,
right? I think
Supreme Court, gay marriage, abortion, LGBTQ rights,
the Muslim ban, narrowing the space for religious diversity in America. I mean, keeping them, even a lot of the immigration policies are really about sort of maintaining a white America. And again, I'm not saying that everyone in that community is racist. I'm really not. But I'm saying that there is a fragility and a fear around the changing demographics in this country and, the burgeoning of and flowering of religious and other forms of diversity that our country was intentionally set up to do that is engendering a backlash in that community towards all the progress that we've made.
And these leaders, again, you call them the Magnificent Seven. I don't like that word, magnificent. I understand why, what it refers to. But they are really fully immersed in the political process, endorsing candidates, telling people you have to vote for candidates. It's immoral if you don't. How can they maintain any tax-exempt status as churches or religions if they're with both feet in politics?
Well, I mean, churches aren't allowed to do that. Of course, they're trying to change that for electoral reasons. But it's called the Johnson Amendment, and it's a provision that's been in place for a very long time that prevents all nonprofits, that includes houses of worship, from being able to politic, so from being able to endorse or oppose any political candidate. And Trump, when he was campaigning, said he wanted to destroy that, and he's been trying ever since. And frankly, we've succeeded. We have garnered unbelievable support from a hugely broad religious community, from the Catholics to mainline Protestants to Jews and Muslims and Buddhists, who've all signed on to letters to Capitol Hill urging members of Congress to please leave the Johnson Amendment intact for the purpose of protecting the integrity of our houses of worship, and that's, we've succeeded so far.
But they violate it every day in practice and get away with it because there's no enforcement?
Well, there's terrible enforcement. That's right. That's right. And there has been really for a very long time. And this is something that we battle all the time. I mean, we have at Americans United a pre-litigation department where we get in, over 1,000 letters every year complaining from people like hopefully our listeners. You can send us them out in the field who say, hey, this happened in this church, or this is happening in this federal or in this local police station, or, and this is happening in this school, and we write. And we actually prevent a lot of these things from going forward because there is a set of these folks who don't realize that they're in violation of the law and who respond positively. Do
you think people like Jerry Falwell Jr. and Tony Perkins could do any long-term damage to Christianity by holding such views and supporting someone who is so clearly, I'd say, un-Christian, maybe a better word? I
think absolutely. I mean, I think there's an author, Kinnaman, who wrote a book called Un-Christian, and one of the problems that he points to is the problem of the way younger evangelical Christians are perceiving the way their religion responds to LGBTQ people. I actually think that this, quote, Magnificent Seven and folks like them, and call them the religious right, are putting a stain on religion writ large. I had a group of Stanford students come visit me on their spring break, and I did a mini focus group with them. And I said, what's the first thing that comes to your mind when you think of religious freedom? First word out of one of their mouths was anti-homosexuality, anti-gay. And the rest of those students agreed. So if that's what people today are associating with even religious freedom, we are jeopardizing our democracy, which is why one of the priorities right now of Americans United is to organize young people and to make sure that we're reaching younger people and making them aware of the importance of religious freedom, and also connecting the idea of church-state separation to so many issues that they care about, but they don't realize are integrally related, like LGBTQ equality, like fighting racism, like abortion rights and reproductive freedom. Right. And we feel like it's critical to reach that next generation of leaders to make sure that they are preserving this fundamental tenet of our democracy, because there's such an effort right now by folks like the Seven to misconstrue the idea of religious liberty.
So that's a good moment for you to, and I'm going to give you the opportunity to people who want to get involved and people who really are concerned about this issue. And concerned about their faith, and they're seeing their faith being eroded by some of these faithless leaders. Americans United, how do they reach you? What's the best way to get in touch? What's the best way to get involved?
Thanks for letting me do the plug. They should go to au.org or follow us on any social media channel, Instagram, Twitter, Facebook, at Americans United. And we are growing this movement. It's becoming more and more powerful every day. And it's coming up in presidential debates now, the idea of church-state separation. It's on people's minds. Now is the time to get active and to fight for church-state separation, like our democracy depends on it, because it does.
And just that, so that we're not accused of throwing religion overboard, I want to close by asking you to respond to something that Senator Chris Coons, senator from Delaware, said the other day about why Democrats need to talk about religion and should. He says it's because, quote, America's still an overwhelming religious country, and the Democratic Party, too, remains a coalition of people of faith.
Mm-hmm. Absolutely. Yeah, I agree.
You agree?
Absolutely. I think it's super important. I mean, we absolutely have a growing population of people called the nuns, Nones, who identify with no specific religion. But at the same time, we are a deeply religious country. And here's the thing. We are deeply religious because our government doesn't support one religion over any others. There have been folks like Fukuyama at Stanford who have studied the religiosity of countries and who've actually seen that countries that have an official church tend to have a less religious population than countries like ours that have no official church in the state. So it is 70% of Americans identify as Christian. You know, so if you want to reach the country, you better honor and respect people for being Christians, for believing whatever it is that they believe, and not disparage that, whether or not you yourself are a believer.
And with that, Rachel Lazar, thanks so much for joining us. It's Americans United, AU.org.
Bill Press talking with Rachel Lazar, CEO of Americans United for Separation of Church and State. If you'd like to hear the entire interview, visit BillPressShow.com. Well, that's all for the America's Democrats podcast. Thank you to all who made today's show possible. Barbara Gottlieb, Lindsay Koshgarian, and the entire Bill Press team. And thank you for listening. If you liked what you heard, please get involved in our efforts to keep this show going and to elect Democrats who are bringing the party back to its roots. Go to americasdemocrats.org and click on Donate at the top of the page. And be sure to find 21st Century Democrats on Facebook and Twitter, and leave us a review on your favorite podcast app. For the America's Democrats podcast, I'm your host, Jim Cuddy. We want you to sit back and listen, but we need you to stand up and fight. Join us. Support the americasdemocrats.org podcast, a project of 21st Century Democrats, and help elect Democrats who will stand up for democratic principles with your contribution today. Go to americasdemocrats.org and click on Donate at the top of the page.